Hi, Adam. I'm Emily. I'll be your nurse today. Can you give me your date of birth, please?
February 16th, 1975.
Okay. And can I check your hospital band? Thank you. And is it okay if I examine you today?
Yes.
Okay. So my patient's level of consciousness, he's awake and alert. He is in no respiratory distress. He's breathing normally. He's able to carry on a conversation, so his speech is normal. His nutritional status is good, so there's no wasting or obesity at all. He's sitting comfortably in no apparent distress or pain. The symmetry of his face appears to be equal as he's having a conversation with me. I'm not noticing any drooping or pulling of the tongue to one side. Okay, so now I'm going to move on to asking my patient some subjective questions. How are you feeling today?
Good.
Any new pain or anything new at all? No? If my patient did have new pain, I would move into the PQRSTU questions, such as when did the pain start? Where is the pain? Where is it radiating? How bad is it? The severity of the pain, how often does it happen, and how does it affect you? I will also check my patient's vitals. So blood pressure, I'd expect to be 120 over 80. A little bit above or below is normal. Temperature would be 37.0 degrees Celsius on average. Respirations would be 12 to 20 per minute. A radial pulse would be 60 to 100 beats per minute. And O2 saturations would be 95 to 100% on room air. And now I'll check my patient's neurological status. So do you know where you are right now?
At home.
And what day of the week is it?
Wednesday,
And what's the date?
April 14th.
Okay, and what's your full name?
Adam McKechnie.
Okay. I will just check the pupils, see if they're equal and reactive. Okay, just follow my finger. Okay, pupils are equal and reactive to light and the same shape and size. So my patient is alert and oriented times 3. His mood and affect is appropriate. He's answering questions appropriately, and he is properly dressed. His hygiene is appropriate. Okay, so now I'll move on to assessing his upper extremities. So I'm just looking for symmetry. They are equal on either side, approximately the same size and length. Looking at the skin condition, which is pink. Both of his arms are warm to the touch, the temperature is normal. There's no edema, and the skin is intact with no apparent rashes or mottling. So I'm just going to check the radial and brachial pulses. Radial pulse, brachial pulse. Which are equal on each arm. And so I'll check the muscle strength now, so you can just push against my hands, okay, and just push up like this, and down, just squeeze my fingertips, okay. Muscle strength's equal on each side, so there's no concerns there. And the cap refill is 1 to 2 seconds on each hand, so that's normal. Okay, so now I will assess the patient's chest, the anterior chest. So I'm looking for the costal angle, the elliptical, and I'm also looking for any symmetry and skin conditions. So the skin is pink, warm and dry. Symmetry appears to be normal. The antero-posterior ratio is 1 to 2, which is normal, so that means the chest, looking at it anteriorly, is wider than it is when you're looking at it laterally. So now I'm going to assess for symmetry, so if you can just breathe in, and the chest rises equally on either side, and I'm going to palpate your chest for any tender areas or masses. So can you tell me, does this hurt at all? No? Okay. And now I will listen to the patient's chest. Starting on the left side. If you just keep breathing evenly and deeply. Okay, and breath sounds are equal on each side, and they are normal air entry. There's no crackles or wheezes or striations at all. And if their patient had any chest tubes or an ileostomy or a tracheostomy, I would check it at this time, or any dressings at all. So now we'll move on to the cardiovascular assessment. So I'm just going to look at the precordium. There's no obvious pulsations, no jugular vein distension. The skin condition is pink, warm and dry, and intact, so that's all normal. So I will listen over the aortic valve. Okay, pulmonic valve. Erb's point. Tricuspid area. And mitral valve. Okay. In a normal assessment, I would listen for where the lub dub was the loudest. I would also position the patient in the left lateral position to get a better listen of the apical rate, and I would listen with the bell as well if there was any concern for any bruits. All right, so now I'm going to move on to the abdominal assessment. If you can just lay down, please. Have you had any changes in your appetite lately?
No.
Any nausea, vomiting, diarrhea, constipation? Are you
No.
avoiding normally? And when was your last bowel movement?
Today.
Okay, so I'm just going to look for symmetry in the abdomen. The umbilicus is in the center, and there's no pulling to either side. There's no scars, stretch marks, no obvious areas of concern, like no masses at all. So now that I've looked at the patient's abdomen, and it's flat, it's not concave or distended. And so I'm just going to listen to your abdomen. If you can move your hands, please. Thank you. So I'll start in the right lower quadrant. And move in a clockwise direction. Bowel sounds are normal and present in each quadrant. They're just a low gurgling sound. They're not tympanic or overactive. And if there was not any bowel sounds, I might have to listen to up to 5 minutes to determine a true absence of bowel sounds. So now I'm going to lightly palpate your abdomen, starting in the right lower quadrant. So that's 1 centimeter, which is my fingertips. And let me know if you're feeling any pain at all. Do you feel any pain?
Mm-mm.
Okay, and now I'm going to move on to deep palpation, which is 5 to 8 centimeters. Any pain at all? So the abdomen was normal. If there was any pain in the abdomen, I would palpate that area last. And if there was any masses or really tender areas, I would not palpate right over them. I would just kind of palpate around them to assess the borders. If the patient had an ileostomy or a colostomy or a catheter, I would assess those devices at this time to look for any output amount, color, odor, that kind of thing. Okay, Adam, I'll get you to sit up now, please. I'm just going to look at your lower extremities. So if you can just kind of pop them up here. So the legs appear to be symmetrical. They're approximately the same size and length. They're warm, and so temperature is normal. One leg is not cooler than the other. The hair distribution is normal. There's no edema in the ankles. Okay. The skin color is pink, warm and dry. There's no rashes and no mottling. Everything is intact. So I'm just going to check for your pulses, your pedal pulses, which are present bilaterally. Okay, and I'm just going to look at your capillary refill in your toes, which is 1 to 2 seconds. That's normal on each side. Okay, and I'll test for muscle strength. So if you can just push against my hands and pull back with your toes. Okay, and push up. Okay, and down. So muscle strength is equal on each side. If there was any dressings on the lower extremities, I would look at that time. Adam, I'm just going to get you to sit up, please, and just face this way. And I'm just going to look at your posterior chest. So I'm looking for symmetry The back appears to be symmetrical. The spinous process is nice and lined up. There's no evidence of any ankylosing spondylitis or any kyphoid curvature at all. And I'll get you to breathe in, please. Okay, and air entry feels equal on each side. And I'm just gonna feel for any tender areas or masses. So can you just let me know if you feel anything?